Today on Fin Voices, we talk with Dr. Jorge Silva, cardiologist, professor, and director of Hypertrophic Cardiomyopathy, or HCM, program at UC San Diego Health. I'm Beth Friedman.
I'm Joe Foster.
And this
is Fin Voices.
Our conversation uncovers a new AI tool being used at UCSD to help cardiologists identify a hidden killer, hypertrophic cardiomyopathy. It's one of the healthcare's most misleading and underdiagnosed conditions, and also the number one cause of cardiovascular death in people under the age of 30. Dr. Silva's clinical background began in Mexico with medical school and concluded with a specialist residency in cardiology at Columbia University in New York. He served as a cardiologist and professor of medicine at UC San Diego Health System since 2012. For the past 4 years, Dr. Silva has also led the Hypertrophic Cardiomyopathy, or HCM, Center of Excellence at UCSD. HCM is an overgrowth of the heart muscle that usually goes undetected until an acute episode of cardiovascular disease occurs. Dr. Silva's team at UCSD recently integrated AI technology from a company called Viz.ai to help cardiologists detect hypertrophic cardiomyopathy earlier in the patient's journey. His team's experience and the outcomes they're achieved is what we're going to talk about today. So, Dr. Silva, welcome to Fin Voices.
Thank you, Beth. Honored to be here.
Absolutely. So, Dr. Silva, as a former medical record coder, I was familiar with the diagnosis of hypertrophic cardiomyopathy, or HCM, but what I didn't know was the frequency, how often it occurs, and what are those challenges. So I'd like to start today's show by having you share with us just some of the high-level description, information about this disease that we all should know about.
Absolutely. As you pointed out, I think this is a misdiagnosed or underdiagnosed condition that many people can carry around. It is estimated around the current prevalence about being 1 in 500 individuals, or even with more now testing and genetic testing as well, being 1 in 200 individuals carrying this condition. The testing advances that we have in the genetic realm has really pinpointed us towards that many people are carrying genetic abnormalities that lead to this overgrowth muscle in the heart itself. But however, there's also many individuals that carry multiple comorbidities, obesity, diabetes, high blood pressure, that maybe lead to other doctors think about this as contributing factors to leading to the overgrowth of the muscle, and then hence leading to a misdiagnosis. As you pointed out, this overgrowth of the muscle can occur and present this condition in 2 forms. One, it's an obstructive form when there's an overgrowth of the muscle to the portion where the blood that exits from the heart to the rest of the body. That area is very thick, and so there's a narrowing of the blood flow path. I always tell a patient it's almost like when you put the thumb on the water hose. You see how the water height goes, exits very pressurized from the hose itself. That's one mechanism of causing the obstruction. The other one is just the non-obstructive form, where the overgrowth of muscle is not located towards the exit of where the heart is located, but it's more on the other parts of the heart, just in the midsection or the tip of the heart. And unfortunately, because of the patient's symptoms, they can develop other multiple comorbidities I mentioned. Overweight because of lack of exercise due to their symptoms, that can lead out sometimes to diagnose of people having like asthma, ongoing chest pains for no clear reason, ongoing sensation of palpitation, and so on. So key player in this, identifying the symptoms, using technology and advanced in medicine to really understand who has this diagnosis, and then what are the next steps for testing in these individuals.
Wow, after hearing that description, it makes me want to go rush to see my cardiologist. Check out to make sure I'm okay. I think I mentioned to you when we were preparing for this that I recently had the calcium scoring CT scans. Now I'm like, okay, what other tests do I need? So let's talk about that in a minute. But first, I do want to reiterate something you just said, which is the incidence of this in younger people. That's just so surprising. It always is a shock, and I'm sure catching it in that population in particular is really important. So the bottom line is we're trying to catch this early in the patient's journey before some sort of sudden cardiovascular event might occur, like a heart attack or something like that, right? That's going to be not only potentially cause death in the patient, but also extremely costly and be, a really serious acute encounter. So is catching it early really the secret here? Is that really what we're after?
Correct. Yeah, I think one of the staples of diagnosing this condition have always been the electrocardiogram. And that's always been, when anybody has any heart-related symptoms, when you go to your primary care doctor or a cardiologist, that's the first test that they do, getting an ECG or an electrocardiogram. And that gives us a bit of a window into what's going on with the heart itself, because once we see abnormalities of the electricity of the heart, whether being a lot of variations in terms of the waveforms itself, that will pinpoint on what's the next step in testing, which traditionally has been at any time we see in a normal ECG is getting an echocardiogram. And by the guidance recommendations, we get an echocardiogram to actually diagnose this condition, because that's a staple also of how we tell if somebody has hypertrophic cardiomyopathy, by looking at the echo, measuring the wall thickness, and then coming down to the conclusion of what the diagnosis is. However, for many years, sometimes ECG interpretation can be challenging, sometimes even the primary care setting. But sometimes the quality on the busy clinical practice is hard to really pinpoint what is the capacity to make a clear, accurate diagnosis with ECG. And we've seen lately with the using artificial intelligence technology that the ECGs can make even much better, filter more of the capacity of detecting these abnormalities. They can potentially diagnose people with HCM. As a matter of fact, with using the tool that we've been using here at UCSD with the Viz AI, can help us identify almost around 80 to 90% accuracy if somebody has a normal heart condition, and then lead to prompting the fast way approach to diagnosing this condition in early onset.
Wow, that's amazing. So you're able to find it earlier and you're able to find it more often. Like what I'm hearing you say is there may be cases of this that would have been missed without some sort of assistance or sort of that second set of eyes and ears that the technology now can provide.
That's correct. Yeah, it's been really critical for us working with this AI technology, because it has now, after multi-models and testing, and also putting into the grind, you would say, of people with the actual condition and looking at the EKGs and how that translates into like the general population to help us identify individuals. There's also the AI is able to diagnose with accuracy with the probability of somebody having the condition highly around, as I mentioned, 80 to 99% of the time. So that's steadfast the approach of not only getting just the traditional echoes, but based on the clinical encounter, you can just even add the necessary advanced imaging that we call like CT of the heart, an MRI of the heart, in tandem with what you get with the echo, to just get a full spectrum of we're not missing anything.
Yeah, yeah. And that's, that thoroughness of diagnosis is so important for so many reasons. So it's just for me as a patient, as a consumer of this, gosh, it's very reassuring. So it sounds like you guys are doing some fabulous stuff there. I'll have to check with my provider. They probably have no clue about this here in Atlanta, but I will find out for sure. Now I know what questions to ask. Speaking of questions, let's talk about treatments. So once it sounds like you're probably going to do multiple imaging tests to really confirm this and verify. So once you've verified HCM, what are some of the treatments that are out there?
Yeah, great question. So once we, define what type of hypertrophic cardiomyopathy, where you have the obstructive form that we talked about, where there's difficulty of the blood exiting the heart, or you have the non-obstructive form, really we'll talk about what are the options. Traditionally, based on the prevalence, about 2/3 of the time people will have the obstructive form, and those are based on echocardiograms, doing exercise testing, the MRIs as well will tell you, and the symptoms of the patients. But and that with new therapies that have been developed using cardiac myosin inhibitors, and these therapies have been approved by the FDA back in April of 2022, have been shown and demonstrate that the pressures inside the heart are relieved to the degree that they don't need to have any major interventions or surgery. historically, a lot of people will need open heart surgery sometimes to cut away the excess muscle, specifically for people that have that obstructed form. But these medications have been shown to even probably mitigate the need for that. And so that's an exciting time for somebody with this condition to have a more precise approach to their condition with these therapies. For non-obstructive forms, we deal with other components, and depends on what their symptoms are, we address with more standard medications. But just the fact of diagnosing early, doing the proper imaging, you can really pinpoint the treatments and at least try to slow the process from getting it worse, because with this condition, if it leaves unattended, it can lead to many consequences. We talked about maybe the sudden death risk and the need for a defibrillator to prevent sudden death. But the other two components that I get worried about with this is developing congestive heart failure, where they have a lot of fluid retention, fluid in their lungs, and that sometimes can be a problem of an incapacitating and debilitating symptoms for a lot of people. And also atrial fibrillation, another irregular arrhythmia that can lead them for a stroke. So, the advent of these new therapies, I think, has been fantastic for a lot of patients, because a lot of these symptoms resolve just by being on the medication for some time. And so I feel we're in a good state, patient with ACM.
I'm going to go back to your water hose analogy, which I thought was so descriptive. So basically, if the thumb's on the hose, then the hose is going to start swelling, right? And that's kind of the heart muscle is getting bigger and bigger because it's having to pump. So, having to prevent sort of this open heart surgery scenario sounds like the way to go. Obviously, in healthcare in general, we're trying to get to preventative. And this definitely sounds like it's helping.
Yes.
The non-obstructive is really curious, though. That's a curious population. Did you say what percentage of patients have the non-obstructed versus?
Yeah, so I mean, again, by prevalent population studies, around 70% will have the obstructed form, 30% are the non-obstructive form. Nowadays, the data might be changing a little bit, but I would say, there's only 30% of the non-obstructive form. And there's ongoing clinical trials using the type of same medication that are developed for obstructive to see if it also helps improve the quality of life and symptoms of people with non-obstructive. Because in principle, these medications allow the heart to relax better, pump a little more efficiently, without consuming a lot of energy inside the heart muscle itself. So the principle behind these studies is to see if these medications can help. And we're participating in this multinational clinical trial with the newer generation of these cardiac myosin inhibitors.
It sounds like you feel pretty optimistic about some of these therapies.
Yeah, no, absolutely. I think I've seen the exciting and positive benefits of these medications on the obstructed arena. So I'm really looking forward to what positive changes will happen on the non-obstructive patients itself. But I want to point out that it also, talking about precision medicine in the 21st century, is that gene therapy has been advancing and developing in a really fast pace with new technologies to do gene editing. And so such is the case that there are newer treatments out there to specifically tackle more of the most common mutations that happen with hypertrophic cardiomyopathy, using gene therapy itself, but also participating in a large clinical trial at a national level. It's a phase 1 trial injecting genes that specifically will tackle the gene that is causing hypertrophic cardiomyopathy. In particular one, there's 8 traditional ones. We're focusing on one of the most common ones that's found in the community.
Wow, that's impressive. And that's the project you're doing, you said, internationally?
This is actually a multinational clinical trial. Yeah.
Very cool. That's exciting. What an exciting time to be in healthcare, right?
Yeah.
I mean, here you have the AI to help find cases, and now we're having these really new innovative medications to help treat. So really good news all around.
Absolutely. Yeah, I think it's a critical point in HCM to have a more precise and robust medicine. Again, this condition was diagnosed 60 years ago, and back in the day, it was just treated with very, very standard therapy. And it wasn't until maybe in the past 6 years where new therapy has been developed. So, more than 50 years has gone without really having a new approach to the treatment. And with technologies and new discoveries of the mechanism of how the heart works, now more precise medications can be developed. So that's an exciting time. I think it's opening the arena for other cardiomyopathies and other heart conditions in the future.
Absolutely. And I know that the technology you're using, the Viz.ai technology, you mentioned the FDA approval of the new therapy, the new medication. I believe they are also approved as a diagnostic assistant, if you will, to help find these cases. So that's important piece too. One of the things I see, because typically being in healthcare so long, you always hear how long it takes to get things approved. I don't know. This is my own personal opinion. You tell me if it's on target or not. It seems like since COVID, I do see things getting approved much faster than they used to be. I feel like we're at the point now where we're like, we can't drag our feet. We need to save lives.
Yeah. I think we definitely learned pretty quickly that we need to do a faster approach of getting people in a healthier state. Especially, not only during the pandemic itself, but all the consequences after the pandemic, what happened with all the complications that arose. Seeing that, late patients and missing opportunities to see them in person and all that stuff.
Absolutely. You're listening to Finn Voices. If you're enjoying the show, consider subscribing on Apple Podcast or wherever you listen to your favorite podcasts.
The future of AI-powered disease detection and care coordination isn't light years away. It's already here. Viz.ai paves the way for the use of AI algorithms and machine learning to increase the speed of diagnosis and treatment in nearly 1,700 hospitals and health systems. Viz.ai also collaborates with 7 of the top 30 global life science companies on clinical trials and market development. Viz.ai identifies patients with suspected disease, informs critical decisions, and increases access to life-saving treatments. Learn why Viz.ai was named one of the world's 50 most innovative companies by Fast Company. Visit viz.ai.
We're back with Dr. Silva, director of the Hypertrophic Cardiomyopathy Center of Excellence at UC San Diego Health System, and we're talking about early detection and treatment of HCM, which what we just learned on the show today is the top cardiovascular killer of people under 30 years of age, which is a bit scary. But what we've been talking about so far in the show is early detection through AI, as well as these fascinating treatments that have emerged. Let's continue with our conversation about thinking about AI use in cardiology overall. I'm curious to ask, what's on the horizon, kind of as a cardiologist, what other use cases for artificial intelligence do you see that are going to be helpful to you, your team, your peers, and of course, your patients?
Yeah, absolutely. I think, as we understand more how to properly utilize this tool, I think what we need to make best use of it is how can it facilitate our workflow and how can it facilitate our day-to-day practice so that we can detect earlier, treat earlier, and prevent earlier when the AI tool understands and recognizes what are the red flags of somebody having a certain condition, right? Right now, using the ECG and finding the abnormalities that pinpoint to somebody having hypertrophic cardiomyopathy has been very critical for us, so we can really, with those findings, refer to their primary provider, so the other cardiologist, to take a look in more detail with subsequent imaging that they already have one, or if they haven't, to order the imaging and be surprised if we find some of the cases of hypertrophic cardiomyopathy. In the practice of using this AI in our institution, we've encountered at least 80 from all the patients that we've seen. We've encountered multiple cases, so it has almost 80 to 90% of detecting new cases within our system, and that's important because many patients linger through the health system just carrying a diagnosis or symptoms for a long time, but just being treated with standard medication that doesn't really change at all their trajectory.
Yep.
So that's one advent. Yeah, so that's one advent, and I think that the forefront will be that using the AI technology not only for this electrocardiogram modality, but also using it for imaging modalities, where you can train the artificial intelligence to read and put in context the images that they're seeing and what did that translate into a clinical diagnosis as well. And at our institution, there are some other colleagues of mine doing their own research in this arena, by looking at MRIs, looking at CAT scans, and so on. So it's an exciting time. I think it's more to come, how we learn, how we can apply it, and how we can integrate it into our daily routine itself.
Mm-hmm. Yeah, I think that I actually attended. So today I had a luncheon with the Georgia HIMSS group, and they had a panel session with CIOs from some of our largest health systems here in Atlanta, and the topic was AI. And there was a physician there. She's an emergency room physician, but she was on the panel and just really honing in on, a lot of people talk about the ambient voice and helping clinicians document and save time, which is huge. I mean,
Yeah.
that's a huge piece. But she really was focused on the ability for these new technologies in specific use cases, right? Like we've been discussing today, for the technology to be able to identify the cases and predict risk or predict, a bad outcome that then we can treat for in a preventative way. So I agree with you. It's a pretty exciting time. And I think we're going to see more and more use cases emerge with these kinds of technologies. So pretty exciting.
Absolutely. I think it's important because, if the technology becomes really usable and translated into multiple platforms that are used through our clinical practice, either private practices, academic centers, or any type of EMR that you use in every day-to-day practice in clinical medicine, it will open opportunities to diagnose people that sometimes, as I mentioned, for example, that are underserved or minority communities where they potentially might not receive the quality of care that you would be in more of an inner city or in other bigger places as well. So having that advantage to offer that for that community, I think is going to be important so we can detect. Something that I've always been intrigued and fascinated about is just the clinical disparities in terms of care among different populations. And lo and behold, we've been more and more, and specifically for hypertrophic cardiomyopathy, we've understand and learned that minorities tend to have less aggressive treatments, less genetic testing, and often more symptomatic when we see them, and more sicker, and more symptoms than we see traditionally in other. This is also in particular a place for women, because women sometimes can carry the diagnosis for many years before being diagnosed accurately because they attribute the symptoms to something other causes, heart related.
That's a good point you brought up. And they talked about today on the panel the one of the concerns around AI was the bias of the data, and it's that the AI is learning from, because these tools are only as efficient as what they've learned from. The physician actually, she gave a great analogy as well. She said, you raise a child and you raise them in your home and you teach them all these things they learn, and that's what they learn, and then they go off into the world and they learn all kinds of new things that may or may not be may or not be good. So she said that was the word of caution, is to look at the different systems that you're employing and using, and ask the vendors and know where those systems are learning from, where are they getting the data from to learn from. So that's very important.
Yeah, absolutely. I think, it's just that given or piggyback on that example is that the AIs are trained to detect the more severe forms of conditions, right? So that way their intelligence can at least detect that aspect. Sometimes they're very limited to detect what are the early onsets of some manifestation of some condition, right? But put in the proper context, and that's where the doctors still need to play a role in that. Put in the right context, you will lean towards your diagnosis. In practical medicine, we use a lot of testing just to confirm our suspicions, to lean that our suspicions are correct, and that actually the tests are proving that we're concept what we had, this is correct, right? And case in whole, years before the troponin, the assays to detect a heart attack were available, actually would detect somebody having a heart attack just based on examining you, listen to your lungs, making sure that you're not having signs of a potential heart attack, right? It wasn't until we got an EKG, it wasn't until we got a cardiac biomarkers that we actually say, oh yeah, somebody's having a heart attack at an earlier stage. And so I think that's probably where AI is standing right now, in an incipient stage where we can at least put it into our context to detect the severe forms of the condition, and we don't miss that portion.
Absolutely. Well, this has been so intriguing and insightful. I really appreciate your time today. We're at the end of our podcast, but I do want to wrap up with asking you my last question for you is, what are the 3 things you're most optimistic about for the diagnosis and treatment of HCM? Because that's your specialty, and I'm curious about, what are you really most excited about in this area?
Well, I think, with I think using AI specifically will be just early detection for either more aggressive forms, and also detecting the forms that are from not only the obstructive forms, but the non-obstructive. Once we find even more of those people that perhaps not benefit from some of standard medications, we can discuss about the approaches of what we can do for in terms of treatment, and potentially even more clinical studies and trials as well. The other component will be about if we find earlier patients, then we will maybe discuss once the gene therapy becomes more accessible and the technology and the evolution of these therapies is just more pristine, you would say, then definitely instituting these therapies in an early stage before they even develop the condition, right? I think that will be like the save grace of these therapies. And also the development of new therapies that potentially are making surgeries obsolete at this point, where you can have a medication that can improve your symptoms to the point that you don't have to have a major intervention. I think it's important to recognize that. So it's an exciting time. I think more molecules are being developed. I think more gene therapy might come in the future. And I think the advent of AI to consolidate all of these diagnoses into one arena in therapies is going to be critical. So those I think they're the three items that I'm more excited about in the future.
Super, super. Yeah, less big scars and less high costs from those open heart surgeries, it sounds like, and less risk, for
Absolutely.
the patients. Yeah.
Absolutely.
Well, Dr. Silva, this has been wonderful, helpful, exciting times. Thank you so much for being on our show. And you can reach Dr. Silva on LinkedIn at Dr. Silva in Cisco, and you can learn more about Viz at viz.ai. So thank you.
Thank you so much, Beth. It was a pleasure.